Hello and welcome. My name is Jorge Delva. I'm the Dean of the Boston University School of Social Work and the Director and Paul Farmer Professor of the Center for Innovation in Social Work and Health. Thank you everyone for joining us for tonight's event, Housing, Homelessness, and COVID-19 in Massachusetts. Safe, stable, and affordable housing is essential to health. At a more personal level, I know firsthand the importance of securing support to prevent homelessness. Without Section 8 and other types of support, I probably would not be here today. Since Governor Baker's eviction and foreclosure moratorium expired in October, individuals and families across Massachusetts are now facing the added threat of unstable housing and homelessness during the height of the pandemic and as we head into winter. People experiencing homelessness are particularly vulnerable to the dangers of COVID-19, and many U.S. health and shelter systems are not equipped to meet their needs. Tonight, our amazing panel of housing and homelessness experts will address the intersection of housing, racial justice, and health, and discuss opportunities to address inequities and provide assistance. This event is hosted by the Center for Innovation in Social Work and Health here at the Boston University School of Social Work, and is part of our Health Equity Speaker Series. Our goal is to provoke thought and stimulate action consistent with the center's mission to expand the impact of social work in healthcare and population health. We define health in broad terms, consistent with the World Health Organization, to include physical, mental, and social well-being, and to involve work at the individual, family, community, institutional, and societal levels. Before I turn over to Professor Tom Byrne, our moderator this evening, I would like to review a few housekeeping items. After our conversation, we will have some time for audience questions. Please type your questions into the chat window in Zoom, and we will take as many as time allows. If you're a social worker needing continuing education credits for this event, you will have received a link in your email confirmation to a quiz that you must complete to receive continuing education credits. We will also share this link in the chat. Also, this event is being recorded and will be available on our website, ciswh.org. And now let's begin. I would like to introduce my colleague, Tom Byrne, Assistant Professor at Boston University School of Social Work, who will facilitate our panel discussion. Professor Byrne believes that everyone should have a safe, stable, and decent place to live. And in fact, that is a fundamental prerequisite for a fulfilling and defined life. This conviction motivates both his scholarship and professional, and I also know from conversations with him, his personal service. His research focuses on homelessness, housing, and veterans, and has been published in journals including Health Affairs, American Journal of Public Health, and Housing Policy Debate. Outside of BU, Professor Byrne serves as a researcher for the U.S. Department of Veterans Affairs, Center for Healthcare Outcome and Implementation Research in Bedford, Massachusetts, and the National Center on Homelessness Among Veterans. He's also very active in a number of initiatives to prevent and end homelessness in Massachusetts. Previously, Professor Byrne was a member of the ad hoc committee to estimate housing need for Massachusetts for the State Intra-Agency Council on Homelessness and the Data Working Group for the City of Boston Strategic Planning Group to prevent and end youth and young adult homelessness. Thank you, Professor Byrne. I'll hand it over to you now.
Thank you very much, Dean Delva, and thank you to all of our panelists who are joining us tonight. I'm very excited about this because we have a group of panelists who are going to offer a wide array of perspectives on this really important issues, coming at it from a number of different angles. So I'm very excited to hear what they have to say, and I'm very excited to hear from you all who are in attendance with the questions that you have for the panelists. So I think it's important to get right to it and hear from folks. What I will say is what I've been saying to to all of my students over the course of this semester, to the panelists as well. Please don't feel any embarrassment if you have any pets, spouses, or small children that cross into the background. You may hear some small children in the background here at my house, so please don't feel any embarrassment at all. And it's I love to see pets and family members. So our first panelist of the evening is Boston City Councilor Andrea Campbell, who is representing District 4 on the Boston City Council. Andrea Joy Campbell's vision for Boston is driven by her life story: the pride of growing up in Roxbury in the South End, the pain of losing her mother, father, and twin brother at an early age, and the foundation this city gave her to overcome long odds and become the first Black woman to serve as president of the Boston City Council. Born and raised in Boston and educated in all Boston public schools, including Boston Latin School, Andrea went on to graduate from Princeton University and UCLA Law School. She was first elected District 4 Boston City Councilor in 2015, representing primarily the neighborhoods of Dorchester and Mattapan, as well as parts of Rosendale and Jamaica Plain. On the council, Councilor Campbell focuses on educational equity, improving public safety, criminal justice reform, affordable housing, and racial equity initiatives. Councilor Campbell, I'll turn it over to you, and we look forward to hearing what you have to say.
Thank you, Professor Byrne, and thank you, Jorge, of course, and to this Boston University for hosting this incredible conversation. It is so timely. I also want to thank, of course, my fellow panelists who are incredible in their own right, doing remarkable work in the city of Boston and greater Boston and probably elsewhere too. So thank you for having me. I'll say a few words about just where, who I am, the issues before us, and some of the incredible things that council frankly has been doing in this moment in time, and then my thoughts sort of on the future, and we'll save most of the time for Q&A. So like you said, Professor, obviously I'm Andrea Campbell and I represent currently District 4, which is largely Dorchester and Mattapan. Those are my biggest neighborhoods. I also have a little bit of Jamaica Plain and Rosendale. I often say it is where every inequity you can imagine is alive and well. Don't just read the reports. Come and you can do a tour in my district and visibly see every inequity, whether it's in housing, our schools, environmental injustices. You will see that is visible very much, along with transportation deserts, food deserts, poverty, and of course neighborhoods that are not only poor, but concentrated with people of color. And I know obviously that affordable housing is critically important. I will also say the issues of housing affordability, development, and displacement have been a conversation of discussion, not only in the last 5 years since I've been on the council, but even when I was a candidate running for office, and they continue to be pressing. And they're not necessarily obviously new issues. And I know this growing up. I grew up in Roxbury in the South End. I live in Mattapan now, but I often drive back through Roxbury in the South End and look at the old brownstone I grew up in. That is no longer, I don't think it's no longer affordable. At least the surrounding houses are no longer affordable. So it continues to be an issue. But I also know, similar to what Jorge shared, how important, whether it's Section 8 or affordable housing or other supports are. I grew up behind Grant Manor, 1850 Washington, with my grandmother. That was public housing, critically important to my life story of success. Also lived in Tenant Development Corporation, which is still ongoing and fighting for housing to be affordable in the South End and in Roxbury. Still connected with the TDC community. That was very important to my success. And then of course now as a counselor and fighting every single day for my residents not to be evicted from their homes or removed from their homes in the midst of the pandemic. So really happy to be on here with folks from City Life. We have an ongoing case that I have been dealing with just today before this panel of a landlord who was trying to push out a resident who has paid his rent on time every single month. And now they are trying to force this man out on the street. And I think some people don't think these stories are real. They very much are. So I think the immediate focus, of course, is making sure that the tens of thousands of Bostonians who are in fear of being evicted during the pandemic, that we're getting them rental relief support, legal support, and any other support they need in order to remain in their homes. That is at the top of the list. And the council, in partnership with the mayor, have pushed for legislation. We've passed legislation to not only require that these tenants and residents are notified of their legal rights, but we're also making sure we're doing everything in our power to make sure that lawyers are available to them. I'm a lawyer by training, so pushing folks in the legal community to offer their services up on a pro bono basis, because they're not, of course, guaranteed legal services or an attorney in a housing eviction case. So critically important. So if there are folks on this webinar who are lawyers or no lawyers, that is a critical need right now in the city of Boston and across the Commonwealth. And I think the city has really stepped up where the state has not at moments, frankly, with respect to the eviction crisis that is upon us. I will also say, as a counselor, my first order of business and my first piece of legislation was the Community Preservation Act. And now we are seeing in the city of Boston millions of dollars being generated every single year for the creation not only of affordable housing, but parks, open space, and historic preservation. And I was really excited to introduce this legislation in partnership with Councilor Flaherty. It was considered bold and courageous at the time because I was only in my first term on the council, and technically it was a tax initiative. And people said, how dare you tax me? But I knew how important it was to create more streams of revenue for to address the affordable housing crisis. And now people, of course, are excited by the millions of dollars they're seeing specifically for this purpose. And we've seen incredible projects come out of the CPA, housing that is affordable for our veterans, for our seniors, creative housing ideas like intergenerational housing, helping our seniors who are living in very large homes in certain communities, but want to age in place, but not necessarily in their large home, be able to move to something within their community while frankly, creatively thinking about how we might turn their home over to a family looking for an affordable home. So we've seen some creative things come out as a result of the CPA. We've also seen projects, of course, that address the issue of homelessness in the city of Boston through some of the CPA work. So we was really proud to lead with respect to this legislation. And going forward, I will say, we're, I think, in a moment in time, and I think everyone is recognizing this, whether we're talking about George Floyd, the racial inequities we're seeing with respect to COVID, all of them being exacerbated right now by COVID-19, that there is and has been a systemic racist effect, right? Or history, I should say, on housing policy. There was an incredible article recently in the Boston Magazine that if you haven't read it, everyone should, that did a really good updated account of the history of redlining and blockbusting in the city of Boston, and how it shows up in the city now. Why we are still a segregated city is because of some of these policies that were perpetuated by government. And why communities like Dorchester and Mattapan, specifically public housing like Franklin Field in my district, which hasn't been renovated in 30 years, why that is concentrated with people of color, Black and brown people living under the poverty line for the most part. It was because of these racist policies in the past. And I think going forward, if we're going to tackle this issue, we have to be honest about that history, and we have to go above and beyond to not only heal, but to have great intentionality with respect to communities of color. And I think the council is doing some of that work with the recent zoning amendment related to fair housing, which is historic in its nature, that would require developers, of course, with every project to look at the effect it will have on affordability and displacement. That took years to do, frankly, which was unfortunate, but there were some advocates who have been involved in that for decades, many of whom are not with us anymore, but historic amendment that we just passed. I think we need greater intentionality on home ownership, critically important as a way to close the racial wealth gap, respond to this racist past, and allow those in our communities to be stable in their housing so they don't have to worry about displacement. There are creative things we could be doing to allow for greater home ownership. I was very proud to bring a program into the Boston Housing Authority. And frankly, it took 2 years to do it. A program that was proven to move folks out of public housing into home ownership opportunities, to allow them to build their wealth while freeing up this critical housing stock for those who are either homeless or desperately in need of low income or no income housing. There are more programs out there. There's more ideas around legislation related to the CPA, right? That was a legislative response that we could be exploring and implementing right now in the city of Boston. And lastly, I think we have to be incredibly creative. I'm often talking about our vacant lot initiative in my district. It started as a public safety conversation, looking at all this blighted property in my district. And frankly, the inequities around that, even all of the city-owned vacant lots, majority of them are in my district. Talk about inequities touching every piece of every issue. But we looked at the vacant lots and discovered the city of Boston had hundreds of vacant city-owned lots where we could build upon those. Everyone agreed something could be done for a community purpose versus it being just vacant. And although it's been years, we've seen some successes in movement. Again, a creative way or how we should be thinking about the issue creatively is activating these lots immediately, cutting the red tape and bureaucracy that often gets in the way of some of these solutions, and allowing folks who are homeless, looking for affordable homeownership opportunities, or getting creative and having business along with housing or some kind of project that is mixed use be situated on these lots. And so I am excited for this conversation. I think I've talked long enough, and really excited to answer questions and to hear from my other panelists, because it definitely takes a multi-tiered approach in every stakeholder you can imagine if we're going to solve for these pressing issues in the city of Boston.
Great, thank you very much, Councillor Campbell. Very much appreciate the note that you ended on there with the need for a multi-tiered approach, and that there's not necessarily a silver bullet to this issue, and needing to pursue all sorts of different solutions. So really appreciate your comments. Our next panelist is Cassandra Clay, who is a professor emerita at the Boston University School of Social Work and a board member at Metro Housing Boston. So in addition to many years of teaching and training in the areas of cultural competence in healthcare settings, trauma, and engagement with multi-stress families, Cassandra also has clinical and research experience, including serving as co-investigator on several state and federally funded grants. She has authored numerous publications in the areas of substance abuse, child welfare training, and positive youth development. She's also served as a senior fellow at the Center for Social Policy at the University of Massachusetts, Boston, where she was engaged in the nonprofit program evaluation. She maintains a private practice that includes counseling, coaching, supervision, and consulting to nonprofit human service organizations, and is a consultant with an affiliation with Empower Success Corps of New England. She's a board member at the Institute for Health and Recovery, Metro Housing Boston, and the Boston University Dean's Advisory Board at the Boston University School of Social Work. So welcome, Cassandra, and I'll turn it over to you and look forward to hearing your contribution to this important conversation.
Thank you, Tom. Thank you very much. And thank you, Jorge, and the Center for Innovation in Social Work and Health. This is such an important topic. We are in a crisis at this moment. And so it is very important that we be tonight discussing this. I am a social worker. And I am representing Metro Boston Housing tonight because I serve on their board. Metro Boston, next slide, please. Metro Housing Boston mobilizes a wide range of resources to provide services that lead families and individuals to housing stability, economic security, and an improved quality of life. We serve more than 25,000 families annually in the Boston metro area. So tonight I want to focus on two programs, RAFT and IRMA. We'll focus mostly on RAFT. These are the primary assistance programs for families who are facing eviction at this moment. And many of you who are housing advocates, and if you've just been reading the newspaper, are aware of many housing advocates and clients who have been complaining appropriately about the slow application process associated specifically with RAFT. So I just want to acknowledge that, because Metro Boston Housing is one of the organizations that manages those applications. And so we're acknowledging how difficult this is during COVID, and want to acknowledge some of the reasons that we think this is happening. One, the slowness is related to limited staff, and the staff used to be around 16. I will say that the staff now has been almost tripled to 50 workers just processing RAFT applications. Now, when you do that, and you're doing it now in this virtual way as a result of COVID, it even complicates things more. The application process is a cumbersome one that requires uploading documents, etc. Vulnerable populations that we work with often don't have the needed even internet services for uploading some of the material. So many of the applications have come in incomplete, and Metro Boston Housing is trying to address this issue with a larger staff and with working with more community-based organizations to get their assistance in helping our clients complete the application process. So, RAFT and Irma are funded by public contracts, primarily from the state and the federal government, and some private grants and donations to Metro Boston Housing. Next slide, please. So I would like to just go through very briefly what are some of the requirements for who qualifies for RAFT and Irma. And a household income must be at below 80% of area median income. Area median income currently in Metro Boston is $94,430. So they must be 80% or at 80% below that. So we're clearly talking about folks whose incomes are limited. Households composed of 2 or more people living together, one of whom is a dependent child under the age of 21. A pregnant mother qualifies if she's the head of household. Individual members with older children, couples without children, unaccompanied youth, households, and here's one of the complications, that households in doing this application must provide documentation and proof that they are currently experiencing a housing crisis. And they have to do it in particular ways. They have to, for households that have rental arrears, they have to prove written documentation of the rental arrears, demonstration of financial hardship that have caused the non-payment. This obviously requires the renter to have communication with the landlord. And that in itself can also be taxing, toxic, troublesome, or can interfere with getting the application completed. The thing I would say about Irma and the difference between RAFT and Irma, with Irma, you can have a slightly higher income. The reason that Irma was promoted by the state, it was to pull in more homeowners for assistance with mortgage arrears, while RAFT would remain primarily for rent arrears. And I would just say during this COVID period, Metro Housing Boston has seen fewer IRMA applications and many, many more RAF applications, which is not a surprise. Next slide, please. Just a couple of other notes about the increase in dollars. The Commonwealth continues to increase resources. And we want to acknowledge that despite the fact that the eviction, that the state eviction moratorium was not continued. Metro Boston is doubling. At the time this slide was done, now we're up to 50 staff. I just want to go down to the third bullet, which I think is really important. RAF used to limit the amount you could get to $4,000, but that now has been increased to $10,000. One limitation, the benefit is only available if the landlord and the tenant execute an agreement to maintain the tenancy for 6 months through June 21, if there are school-aged children in the household, whichever is longer. So this process is more complicated, it may require more time, but the amount of money available for rent arrears has been increased. And starting in a few weeks, landlords who have 20 or fewer units will be able to initiate a RAF application on their own with the tenant's signature on the application. So the landlord door will result also, we hope, in more RAF funds going directly to the landlord. Next slide, please. This is just a breakdown. I thought you might be interested in some demographic information in terms of the RAF dollars and the demographics. So you see in terms of race, there's a race breakdown in table 5. And then in table 6, you see the average age of a head of household who's receiving RAF. You see the percent of households that are female, the percentage male, the average household size, and then the average annual income for people who received RAF. Next slide, please. And this, I'll just go through quickly. I think the most important thing to pay attention to would be on your right, where you can see most of the RAF dollars that a client or a family gets really goes to rent arrears. And that's the primary support that people who have back rent can get this $4,000 and now possibly up to $10,000 to take care of arrears. So you can see the percentage. And what's interesting is to look at in FY19, the percentage that went for rent arrears was 46%, and look at FY20, which includes COVID, and you can see that that percentage went up to 60%. But you also see that RAF monies can be used for some of the other things you see listed here: security deposits, utilities, rent stipends, etc. Next slide, please. And here we want to show households that received RAF comparing March to August 2019 versus March to August 2020. And so if you see the graph, you see that the same period 1 year later, there were more than 1,400 families who had received support. That just gives you, it's just some data that supports that the need is increasing every day now, given COVID. Next slide, please. And then this looks at March through August. And provides you even with more data showing the increase in the number of people comparing the 2019 year with 2020. Next slide, please. Next slide. And here we see a surge in the households assisted. Again, a look at the difference between these 2 years and the number of dollars that were spent. Looking 12 months in FY19, 4.4 million, and the number of dollars just for 7 months in 2020, March through October, with the $6.9 million. Next slide. Next slide, please. And I just have couple of more slides. This is the big takeaway. What we are now seeing is that families who live in market rate housing, that is, the housing is not subsidized, these are the new families that are most at risk. And these are the new families who are applying. They have never applied before for RAFT. And this is because they have lost their jobs and they have no or limited income to pay for rent. So this is a new category of people who were vulnerable even when they were doing market rate, but they were either by cobbling their monies together with a lot of roommates or a lot of family members, but now they are seeking RAFT support. So I think this is the big takeaway for us is we're seeing a new population. Next slide, and this is the final one. Dollars spent on RAFT again have increased, and all of the increase went to unsubsidized households. And we can talk later. There's an article in the Globe today about explaining why subsidized households, in this case, may be in a little better shape for certainly not being evicted than the unsubsidized households. Thank you very much.
Great, thank you, Cassandra. I appreciate you sort of driving home the point that we're in sort of new and uncharted waters with respect to the populations that are now facing housing crises, and noting the huge increase in rent arrears, or dollars being spent on rent arrears, and kind of a new group of families seeking assistance. And you alluded to the Globe article this morning that talks about sort of geographic shifts in where evictions are taking place, and I too hope we can return to that in the Q&A. So just highlighting kind of the really new territory that we're in here with respect to this issue. So thank you. Our next panelist is Josh Cuddy, who is the Director of Housing Initiatives at the Massachusetts Housing and Shelter Alliance, which is more commonly known by its acronym of MHASA, which I'll, for the sake of brevity, refer to it for the remainder of the presentation here. So Josh helps facilitate MHASA's health and housing partnerships, as well as assists with contracts and data analysis. Prior to joining MHASA, Josh worked as a researcher at the Institute for Organizational Excellence and as a policy associate at the Texas Criminal Justice Coalition. He began his career as a case manager at Wayside Youth and Family Support Network. Josh has a Master of Public Affairs degree and a Master of Science in Social Work degree from the University of Texas at Austin. He completed his bachelor's degree in psychology at Providence College. So Josh, I'll turn it over to you and look forward to your presentation.
Sounds great. Thank you so much, Tom. It's an honor, and I'm incredibly humbled to be presenting with my fellow panelists who've dedicated their lives to really challenging the equities we see in the Commonwealth, as well as I'm grateful for the Center and for BU for hosting this really timely talk. and also very nervous to talk with you, Tom, whose research really inspired me actually to go into this work. Been a big fan of you and Dennis Culhane since graduate school. I'm going to share, I have a PowerPoint, so I'm going to share my screen, sort of more to keep me guided around sort of the overview I'm going to give of what we do at Mahasa and our focus on ending homelessness, and specifically individual homelessness, as well as the impact COVID-19 has had on our work. First, as I mentioned, Mahasa's mission is really ending homelessness, particularly with a focus on individual and chronic homelessness, which under the HUD definition is individuals who are presenting with a complex physical or mental health condition and have been homeless for periods longer than a year or a year within 3 years. We're not a typical sort of policy intermediate organization where we're working to sort of create funding in the legislature or through other government entities. We're really working to create funding sources and pilot sort of innovative programming that works to end and address homelessness through our 83 member agencies across the Commonwealth. We test out these sort of pilot programs that are innovative and show sort of cost reduction of emergency services, and more importantly, provides permanent supportive housing to individuals, and then work to mainstream those across the Commonwealth. Oh, I did not hit start slideshow. But continuing on to the next slide. Chronically homeless individuals account for roughly 10% of the homeless population in Massachusetts, roughly 3,000 in the state, but they account for a much higher percentage of the emergency response dollars. To think this through, without stable housing, how can we ask someone to manage the symptoms of their mental health or manage an illness such as addiction? If someone is living in a shelter, how can we ask them, if they're closed, the shelter closes at 6 a.m. each day, how can we ask them to sort of find a job or sort of be able to, in the government's terms, pull themselves up by their bootstraps? For this population, specifically for chronically homeless individuals, which I'll show on the next slide, sort of suffer from a myriad of complex physical and mental health conditions, our emergency response systems have really become the response in lieu of access to affordable, permanent supportive housing. Recently, we noticed over the summer, research shows that approximately 1 in 5 homeless individuals in Boston spent the previous night in an upstream system of care, which could be the emergency room, a private psychiatric hospital, or our incarceration jail prison system. These systems are costly, and they perpetuate a cycle of individuals who are intersecting, in the case of the ER, are being admitted to the ER in a mental health crisis, are possibly being sent to a psychiatric, private psychiatric hospital. And upon discharge, there's limited sort of step down or access to permanent supportive housing. So oftentimes they're being discharged back to the street or shelter, perpetuating a cycle that doesn't address the need of housing and sort of leaves individuals distrustful of our system and just willing to engage. What we know works, as I'll show on the next slide, oh, that's the healthcare system slide. Tying into this, what we know from sort of our programming, Home and Healthy for Good, which is a state line item program that funds the creation and support of permanent supportive housing across 21 member agencies, nonprofits provide housing across the state, as well as our Pay for Success program that has housed over 1,032 individuals over the course of its 6-year program start when it started in 2015. We're seeing that there's those who are intersecting in this program are being housed. There are significantly high rates of mental health diagnoses, almost at 91%, oftentimes presenting with co-occurring substance use disorder or with physical health conditions, 50%, oftentimes presenting with COPD, diabetes, or other symptoms that oftentimes create a mortality rate that is 3 to 5 times higher than the general population. And as Tom will know very well through his research, oftentimes they will age faster at a rate of 15 to 20 years as compared to the general population. In part of my role at Mahasa, I oversee our Home and Healthy for Good and our Pay for Success program that's built under the notion that providing housing first for individuals who are chronically homeless will allow them to sort of, coupled with permanent supportive services such as CSPEC, which is a case management Medicaid service, will help them sort of more overcome if there's challenges around their mental health, challenges around addiction or vocational need, that providing housing first instead of a system of moving from shelter to requiring sobriety to move forward to the next step of possibly transitional housing or short-term housing, to then moving to sort of being able to pay rent on their own, is not as effective. And that permanent supportive housing we've shown for this population can produce significant cost savings on the medical system, on the correctional side, when you factor in program implementation. In the coming weeks, we have a Medicaid study with Blue Cross Blue Shield Foundation. We're really excited that will be coming out to show the impact of these programs. Now, in relation to COVID-19, as I mentioned before, our emergency shelter system, the issue of street homelessness for this population is not something that has always existed within our society. Really sort of at a 30,000 view overview, this really became a big picture issue in the 70s and 80s as we saw deinstitutionalization within our mental health system, not coupled with a decrease in funding at HUD and sort of our supportive medical services, and a loss of a niche market of being able to pay for sort of room to rent or SRO type rooms on a daily, nightly base to provide housing. When we think of COVID in these settings, the idea of social distancing or other approaches in a congregate setting that to prevent the spread of this disease is misguided at best and a cruel joke at most. These are settings where we're working with bunk beds. Individuals are doubled up and oftentimes sleeping within 50 square feet of each other, which goes against the CDC guidance of 110 square feet within each other. And it really shows that given the health disparities of this population, there is a high risk for increased levels of emergency hospitalization, need for a ventilator, and ultimately mortality. When this first occurred in March, and we were sort of getting an understanding of what this virus would mean and sort of the impact it would have in the United States, Tom Byrne, in partnership with Dennis Culhane and Dr. Kuhn, released this really impactful study that showed sort of the related emergency healthcare costs and potential mortality rate within this population. It is during that time we began, as our fearless leader, Joe Finn, and my supervisor, Joyce Tavon, pushing the state around what an emergency response would be and utilizing FEMA and MEMA resources to sort of create non-congregate sheltering that can safely protect homeless individuals from being in a situation where they would be exposed to COVID-19. In that time, it's actually when Joe was able to sort of, in partnership, work with the Massachusetts Emergency Management Agency, and I served as a homeless service liaison with MEMA on the mass care emergency response team. It's in that work as we prepared the FEMA declaration disaster, we mapped out the number of beds across the state and really mapped out, oftentimes as in the winter times, there will be 145 beds in a shelter funded by DHCD, but oftentimes the rate of homelessness is higher in the winter, that more people are sort of going to the shelter rather sleeping out rough, and they'll be actually having 160 people in their shelter. And proposing to get funding from the federal government through FEMA to sort of reduce the shelter almost in half to allow for social distancing capacity, as well as the creation of new sites, ideally college dorm rooms that are non-congregate, hotel or motel rooms, as well as sort of, in some cases, local YMCAs, or whatever we could find on a really short-term emergency basis. And what that looked like at first is decongregation, depopulation. If possible, at the initial stage in March, we were working to provide rapid rehousing across our members or move people into permanent supportive housing or short-term housing opportunities, and using sort of triage of assessing if they can move in with a family member or other diversion methods. In the time of April to May, there was the possibility of providing shelter outside and using up tent solutions that were spaced out and socially distanced, which it helped implement across 12 communities, Springfield, Worcester, and Boston, and the amazing work of Healthcare for the Homeless and Pine Street Inn are truly leaders, as well as sort of Pine Street Inn bringing on additional sites such as the Suffolk University dorms. Unfortunately, this often occurred a little bit too late. We were fortunate to secure universal testing across many shelters. And in the case of Pine Street Inn and shelters in Worcester and Lowell, when universal testing was conducted within these congregate settings, multiple shelters had a high positivity rate of 35%. Fortunately, we did not see the projected mortality rates that was expected, but we noticed that unfortunately the emergency response was too little too late. In part, there was also, on the state level side, quarantine isolation was set up through the Massachusetts Emergency Management Agency, the COVID-19 Command Center through OHHS, and again, the great work of the City of Boston and Boston Healthcare for the Homeless, who worked to stand up hotel solutions for allowing for quarantine isolation for individuals who were exposed to COVID-19 and were asymptomatic or minorly symptomatic and did not need a high level of medical care. And sort of within those settings, working to really provide wraparound, obviously because isolating for 14 days at a time is incredibly challenging on one's mental health. Through the work of Commonwealth Care Alliance, as well as Elliott, working to wrap around supports around access to mental health, medicated assisted treatment if possible, and working for post sort of discharge coordination planning around ensuring these individuals had access to permanent supportive housing and were connected to their COCs and local agencies. Now, where we are now, over the summer, through some of our projections, there was a projected shortfall we saw of 800 shelter beds as we were heading into the winter, as well as over the summer, areas such as Boston were reporting a 40% rise in unsheltered homelessness. At the time, DHCD was working to secure additional beds, but we didn't know exactly what that would mean. As I said before, emergency shelter is a solution that came out of the 80s to an emergency problem, and it's a Band-Aid solution. And really the need is to sort of push for more innovative solutions that really address the underlying need that I've tried to demonstrate with the slides around healthcare utilization, is that housing is a human right and allows individuals to more manage their medical and behavioral health needs. Part of that we've worked is to sort of secure a carve out of acquisition of hotels or motels that could more easily be, upon rental or acquisition or purchase, could be transformed or sort of changed into permanent supportive housing and housing units for individuals who move into those. We're pleased to see that the state level that there's roughly a $10 million carve out through CDAC. But really what we're seeing now, and what we're grateful for as an emergency solution though, is that it will be $37 million additional funding through Department of Housing and Community Development to create 1,300 additionally socially distant shelter beds across the state. We're seeing a breakout of approximately 400 will be going to Boston, with 125 going to Somerville, Cambridge, Lowell, Lawrence, 120, and sort of North Shore and South Shore, 1,657. At this time, though, we don't know exactly what that means. I think, as I mentioned before, that permanent supportive housing and non-congregate sheltering is the ideal solution when we look at sort of positivity rate and what we learned from earlier. But this is sort of an emergency time and sort of a crisis in which we need to utilize to move us forward to address this inequity of housing that we're seeing across the Commonwealth and across the country. I'm gonna now stop sharing my screen. That's it, but obviously during the question and answer, I could dive more into the weeds around the emergency response.
Great, thanks very much, Josh, and appreciate you mentioned some of the work that I've been privileged to be involved in, but also want to kind of give credit where credit is due to Mahasa, and your president, Joe Finn, has been out in front in talking about housing-focused solutions to homelessness for a long time, and kind of as the data you showed makes it clear, not only is providing housing as a solution to homelessness the common sense thing, the moral thing, it also is something that has benefits to society, potentially into the public purse in terms of savings in other systems as well. And also just appreciate you mentioning one of the things that the pandemic has sort of laid bare is that our emphasis on emergency shelter as kind of a primary response to homelessness, as we've had over the past couple decades. It's sort of laid bare that shelter is not an effective solution for actually ending homelessness, although it can be incredibly important for keeping people safe and when they're facing housing crises. So appreciate you highlighting those two things.
Thank you.
Great. So our final two presenters are Katie McCann and Francis Amador from City Life Vida Urbana. Katie McCann is a community organizer at City Life Vida Urbana. She's also a graduate of the Boston University School of Social Work and the Boston University School of Public Health, and became involved with City Life first as an intern while she was completing her MSW, and later joined City Life staff as an organizer. And Francis Amador is also a community organizer at City Life Vida Urbana. She was connected to City Life when she received a notice to quit. She organized a tenant association in her building to fight against evictions and later joined City Life staff as an organizer. So welcome to both Katie and Francis, and look forward to hearing what you both have to share with us.
Thank you so much. Thank you, Tom and Jorge, and thank you to the Center for Innovation in Social Work and Health, and to all of the panelists. It's great to be here with all of you. I'm going to share my screen. So Francis and I are going to talk with you about the displacement crisis in Massachusetts, which has been a public health crisis long before COVID-19 and is rooted in systemic racism. And we're going to talk about the work that City Life has been doing before the pandemic, as well as how we are responding to the pandemic. And so Francis is going to share our mission and vision with you.
Thank you, Katie. Thank you everyone for having us here. Our vision and mission. City Life Vida Urbana is a grassroots community organization committed to fight for racial, social, and economic justice and gender equality by building working class power. We promote individuals' empowerment, develop community leaders, and build collective power to affect systematic change and transform society. Our vision. We at City Life Vida Urbana embrace a vision of society and world where there is a peace among nations and peoples, respect for our culture, racial and sexual diversity, cooperation rather than competition, no extremes of wealth or poverty, respect for nature and the condition of the environment for ourselves and the future generations. Productions that serve the needs of the many rather than the greed of the few, as well as a guarantee that each person has the right to food, housing, healthcare, education, meaningful employment, and the right to exist in a freedom without fear of displacement or deportation. We understand that these changes will not happen spontaneously. We hope to be part of a city, state, national, and international movement that believes in a similar vision and is prepared to build organizations and leadership that it will take to create this new world. And at City Life, we work with a strategy, and we have the sword, the shield, and the offer. And as of right now, during this COVID-19, we've been working from home, and the sword has been our public letters and our protest. And the shield has been all these letters that we had sent to landlords to protect ourselves. And the offer will say, Katie.
Yes, so we use the strategy, what we call the sword, the shield, and the offer to describe how we fight against displacement and fight for long-term housing stability. And so as Francis described, the sword is all of the ways that we put public pressure on corporate landlords and on banks in order to get them to negotiate. Especially we do this through protest, but also like Francis mentioned, public letters too. The shield is our legal partners, and the offer is the long-term solutions that we win for housing stability. So that can sometimes mean legislation, or that can be long-term contracts like a tenant association that we work with in Mattapan at Morton Village recently won a really strong 5-year contract with 3% rent increases each year, and that's an example of the offer. And so we continue to organize in ways so that we can get long-term contracts or get housing out of the for-profit market and purchased by nonprofits to be permanently affordable. So this crisis has, the displacement crisis has obviously been a major public health and racial justice crisis long before the pandemic. If you're interested in reading more of the research about this, we put out a report earlier this year on the disproportionate impact of displacement on communities of color in Boston. And we, before the pandemic, we've been seeing many patterns of displacement in communities of color, especially a lot of no-fault evictions and building clear-outs. On the first slide, the photo there showed a tenant leader from Fairlawn Apartments, and that's a building complex in Mattapan where several of the tenant leaders were actually on WGBH this morning, and I'll put the link in the chat to that, as well as a few other links. And they are fighting against no-fault evictions after a corporation came in and are trying to displace them after they, long-term residents, organized for decades to bring better transportation to their neighborhood. And so that's an example of what has been happening long before the pandemic. We're still seeing a lot of no-fault evictions happening during the pandemic as well, like the case that Councillor Campbell mentioned, and also Francis Building, which she is going to talk about a little bit later on. Now, during the pandemic, according to our most up-to-date research, approximately 86.7 thousand households in Massachusetts are at risk of displacement. And both last week and the week before were record numbers of filings for non-payment evictions in Massachusetts in 2020. And that doesn't even include no-fault cases like the ones that I mentioned. I'm going to share the links to that data dashboard and some other data on COVID eviction filings as well. And now with the pandemic, more people are understanding that housing is a public health crisis, even though it already has been, and are also understanding that displacement is not the fault of people being evicted or foreclosed, even though that has always been the case, that it has not been the fault of people who are facing displacement. And so we've been responding to this crisis in a variety of ways. Right from the very beginning of the pandemic, we organized to shut down the housing court and then to win a moratorium, which was the strongest eviction and foreclosure moratorium in the country for several months. But unfortunately, as we all know, the moratorium has expired and we're now in this massive eviction crisis. We've been fighting for legislation on the state level and also in coalition on the federal level, and trying to respond to the crisis, on all levels. And Francis is going to talk about our hotline and some of the work that we're doing, working directly with tenants who are facing eviction and homeowners facing foreclosure.
Thank you, Katie. And as we said, we implement this hotline. It's in Spanish and English, and we are working directly with people who is facing evictions or has notice to quit or has not be able to pay their rent. So we give them sources where they can find source where they can apply. We also heard from our hotline calls, people looking for mutual aid, such as food. So we also provide them information where they can go and get food. We also have a website, our homepage website. We provide these resources during the COVID-19. So we have a website in English and a website in Spanish. And also you can find there our hotline numbers in English and Spanish. Also, you're gonna see there our Zoom weekly meetings that we do it with Facebook Live. Also, you're gonna find a source where you can apply for rent relief. You're gonna find the CDC moratorium declaration. If you're eligible, you can sign it and send it to your landlord. You're also gonna find our pledge of resistance to defend your home and neighbors. So you can sign that in our pledge of resistance. You also gonna find templates in Spanish and English where you can write a letter to your landlord or to your bank. And also you're gonna find information about know your rights as a tenant and as a homeowner where you can share it too. And City Life has been working in the last few months and to pass laws, legislation laws, and also last week, some of the work that we recently have done is last weekend, Friday and Saturday, we had 2 actions. One action was in Dorchester, where a landlord is trying to evict a tenant who was always had paid his rent on time. And also we had on Saturday another stand out in East Boston and 168 Gulf Street, and that is my tenant association where we're fighting for a fair lease. So this is some of the examples that we're working on, and I'll pass it to Katie.
Katie, I think you're on mute.
Thank you so much. Thank you. I apologize for that. So thank you, Francis. As we're continuing to fight against displacement on the local, state, and national levels, and continuing to develop our strategy of how we're going to fight in the next year. If people are interested, Right to the City is having a national briefing tomorrow on some of the next steps of what we are fighting for on a national level, which is at the very minimum a 3-month extension of the CDC moratorium, and as well as an expansion of that moratorium and an expansion of rental aid to cover the massive rental need. We're also developing our strategy on the state level, and we're continuing to organize on the building and community level as well. And as you can see, this is an action that we did outside of the housing court, and these are coffins, which on the other side of these coffins, it says eviction equals death. And that a recent study that I'll also share in the chat showed that lifting state eviction moratoriums caused as many as over 433,000 excess cases of COVID-19 and over 10,700 excess deaths from March to September. And so this is an even more urgent situation than ever before, and displacement was already a public health crisis before, and this is even more true during COVID-19, and so it's even more important that we respond in all of these ways right now. Thank you.
Great, thank you very much, Katie and Francis. Very much appreciate and am sympathetic to the vision and mission of City Life in the way in which they frame housing as a human rights issue, as a rights issue, and also appreciate you both sort of highlighting the fact that many of the inequities that we see being manifested as a result of COVID-19 actually are things that existed before and are being just exacerbated by the current pandemic. So I'll encourage participants to enter any questions that they have in the chat box at this time. I've seen a few that have come in, and rather than pose one myself, I think I'll borrow a starting question, which is an excellent question that's been posed in the chat box, and pose it to the panelists. But would encourage everyone to type questions that you might have in the chat box, and I'll try and get to them as many as possible. So the first question, this is a question from one of our attendees, and it is, thank you for sharing such important insights about how the pandemic has affected our most vulnerable. I've worked in affordable housing for the past 2 decades and have often thought about how we can best play a bigger advocacy role. The root issue is the continued oppression of our most vulnerable in systems that perpetuate the cycle of poverty. What innovative strategies have been developed to address the systemic issues that exist across various sectors? And I'll open that up to any panelists who might want to take it.
Well, I can say a few words, Professor, because I have to actually jump. I'm a little behind for another Zoom, so I apologize in advance for having
No,
to.
we appreciate the time you've been able to spend with us. So yeah, sure.
Great, and of course, thank you again to all of my co-panelists who are doing remarkable work. You know, each of our roles are essential, so thank you. I will say, I mean, I think one, it's acknowledging the scope of the problem and how we got here, and I think it's critically important to be honest about the role of race and racism and systemic racism, not only in this country, but in this city. And I think sadly, there are still many who want to deny that history, as though, you know, even though it's very painful, we have to confront it head on. And I think if we don't do that, we won't be able to get to the systemic reforms that we're talking about. And I think the second piece, of course, is that all these systems are connected. So we're here talking about housing, of course, critically important, but we know our residents need mental health supports. They need a solid education starting at pre-K, which for me, I define as birth to 5 years old. They need a living wage. They need access to employment opportunities where they can continue to grow that wage and move up in terms of their career. Many of the folks who are devastated right now in my district are not just because of the housing issue of evictions, they've lost their jobs. And these are low wage workers, right? Who we're gonna have to be really creative in our COVID response and recovery to get them back online. And that's gonna be workforce training and more education. So all these systems are connected. We haven't even talked about the policing system or the criminal justice system where Black and brown men and women are gone, right? They're removed from our community, they're somewhere. Or immigration, right? Folks right now being deported, or the school to immigration pipeline or school to deportation pipeline that many have talked about. All the systems are connected. And I think there are some folks across the country at various levels of government responding really well and recognizing those connections and saying that we need systems reform, not sort of a Band-Aid approach. But you often see it in, say, a community, right? Or a neighborhood, or in my case, I'm a district counselor. So I've used my district in the last 5 years to try to do some creative things across various systems. But I think it's critically important to have leadership and leaders that understand the importance of all of these systems being connected, rooted in a very painful history, and then rolling up our sleeves to say each and every one of us, regardless of what industry you're in, where you're situated, has a role to play in unraveling these inequities in such a way that every single person lives to their full potential. And I think it really gets at the mission of City Life in their opening statement and vision. And that's what I'm about. So I think there are some great examples of that. Happy to talk offline again. Again, my apologies for having to jump off early for the next Zoom, but thank you all so much. Stay safe and healthy and enjoy the holiday season. And I'm sure I'll see many of you on the next Zoom platform.
Likewise. Well, thank you very much for your time, Councillor Campbell, and really appreciate it.
Thank you.
So that sort of the same question, would any of the other panelists, I'd invite other folks to chime in with responses to that question, which is sort of about sort of strategies to address sort of systemic issues across various sectors. And while folks are thinking about it, just want to call attention to the fact that Katie has put a lot of the information she said she would share in the chat box itself, but invite any of the other panelists to tackle that question.
Oh, Francis, did you want to go? Yeah, I can just add that I think that the model that we do of how we organize, and we do casework organizing, so we're not just doing casework working with people in their individual cases, we are answering their questions and helping them get connected to resources, but we're always connecting cases in every way that we can together, and supporting people to organize and to know that just because their landlord has a legal right to bring an eviction case, they also have a lot of rights too, and they have a right to challenge the ways that the landlords are trying to make profit by displacing them. And so I think that yeah, the work that we're doing, challenging these dominant ideas that prioritize profit, and really pushing back against those and not just focusing on responding to the issues, but on proactively organizing.
I mean, I would say the large systemic issue is around economic inequity. It's about the fact that there in this country, in this city, are the very wealthy and the very poor. And that disparity, which comes down to people having income to afford decent housing. And unfortunately, that large systemic issue, I don't know if I have I haven't seen solutions to that larger systemic issue. That is one in which we have to continue to work hard at both on the political side and on the advocacy side. But it comes down to what we value in terms of fairness and equity in people having decent wages. I mean, I think some of the more interesting cross sections, certainly Metro Boston Housing is doing more and more work with health. And a lot of the hospitals now are placing managers, case managers in hospital settings, recognizing that sometimes people are not accessing healthcare because they're in housing stress or distress, and that there's a responsibility, therefore, to be holistic in that approach. So that's one of the innovations that I'm seeing, but it doesn't solve the larger systemic issue of inequity in economics.
Tying in a little bit to the work on the individual homeless side, if you look at sort of the demographic or breakdown data of who is chronically homeless, you see the average profile of someone who is 55, white, male, with severe mental illness. And the reality is that individuals or Black or individuals of color with severe mental illness are far more likely to intersect with the criminal justice system than sort of last in the shelter system and get that chronic homelessness status and move into access HUD or varying resources for permanent supportive housing. One, I think we need to rethink, as I mentioned before, our shelter system and sort of how our criminal justice system interacts with individuals who are homeless, as well as with the healthcare data, looking at sort of community benefits, investments into housing, predictive modeling or sort of utilization of claims data, which we've been working on and grateful for our partnership with Massachusetts Behavioral Health, who I'm MVHP Beacon, my colleague Erin Donahue is actually attending this webinar, but looking at sort of claims data and seeing people who are caught in that system of inpatient admissions or hospitalizations and sort of working to disrupt the cycle and connect them with permanent supportive housing. But using that investment and sort of rethinking these systems and how we address individuals who are chronically homeless and struggling with the symptoms of their mental illness.
Great, thanks. So I want to make sure that some folks had some real concrete questions, I think, about RAFT. So Cassandra, I'm hoping you can answer these questions quickly. One was about whether...
If I can, I'll put my email in chat. And
sure. So one was about anything that's being done to kind of streamline the application for RAFT. And another was about sort of whether RAFT is just available to people in Boston.
The second question is, I mean, RAFT is a state and federal program, so it is not limited just to Boston. Metro Boston Housing manages RAFT in the Boston area, but all communities throughout the state should have some access to RAFT services. The other question about streamlining the application process, I wish I could be more optimistic. There has been some tweaking, but it is not, streamlining probably is too strong a word. What I would say is that Metro Housing Boston is now working with a number of community-based organizations whose workers have been helpful in assisting families in getting the application process complete, because it can be cumbersome, it can have linguistic challenges, and so we've been working with varied community-based organizations who have workers who are willing to help people with that application process.
Great, thanks. So we're getting a flood of questions here, and what I'm going to try and do is combine a few of these questions into a bigger picture question for the panelists. So there was a few questions about kind of creative solutions to housing folks through shared or cooperative housing. There's a few questions about zoning and thinking about changes to zoning, which is, you know, a strategy that's been pursued in some places, perhaps most notably the city of Minneapolis, which got rid of single family zoning entirely. So I'm going to pose this question and preface it with something that was in the introduction to the Harvard Center for Joint Housing Studies, most recent version of the State of the Nation's Housing, which is an annual report, and the most recent version of which was released at the end of 2020. And in the introduction to that report, they argued that today's crisis conditions call for a comprehensive re-envisioning of national housing policy. So my question for each of the panelists is, if you had the power to make one policy change to address the issues of housing affordability and homelessness in Massachusetts, what would it be and why? And you can draw on potentially on some of the solutions that folks have asked about here, whether it's zoning or shared housing or any policy change that you think would be important, or the most important policy change.
I mean, I don't know if I could say what the most important
or if you had to pick one that comes immediately to mind, then you won't be held to it.
Right. Certainly in many of the suburban communities, zoning is critical, and we know that there's been a huge pushback in suburban communities to increase affordable housing. And they have used the zoning laws as a way to push back on that. I mean, there has to be more housing. So if there's one policy, it's a policy that increases the amount of affordable housing. And in major cities, and you know, in major cities with enormous wealth, there's been resistance to that because real estate folks could build expensive condominiums and get millions of dollars for them, and not get and not have the same incentives, you know, for affordable housing.
So I'll ask you just in quickly in 1 or 2 minutes, Josh, Katie, or Francis to kind of weigh in with a policy change you'd like to see.
I'm definitely not a zoning expert, but I would really social work, public affairs background. There's not enough affordable housing, and there's definitely re-examination around home rule and zoning policy, specifically within the greater Boston area. And within Boston itself, if you ask Pine Street Inn, if they're moving forward with a permanent supportive housing project, they're more likely to go for a much larger 100-unit project, given sort of the challenges they're going to come up across with zoning and potential lawsuit from local businesses. Tying beyond that, for this population, we really need to rethink sort of how the fragmentation of our healthcare and sort of Medicaid mass health system, and Department of Housing and Community Development, and even our criminal justice system, and how sort of individuals are becoming wrapped up, as I mentioned, this cycle of care and better communication across these agencies, and sort of utilizing predictive modeling or identifying when someone with severe mental illness or anyone who's in individual homelessness is having the right triage response to ensure that homelessness is something that is infrequent, non-reoccurring, and moving towards a functional zero.
Great, thanks. So Katie or Francis, if either of you wants to weigh in.
Yeah, I think that that the most important types of legislation that we need right now to stabilize tenants and homeowners is legislation like the Guaranteed Housing Stability Bill, which now the legislative session is nearing its end, but we're going to definitely continue to fight for strong protections for both renters and homeowners, including small landlords. And so this bill would ban evictions related to COVID-19 related non-payment. It would stabilize rents at pre-COVID levels. It would prevent no-fault evictions, and it would enable homeowners and small landlords to defer mortgage payments. And it would also establish a rental relief fund for small landlords specifically to prioritize the funds toward them. So those kind of protections are really needed to stabilize everyone where they are right now, while we also work toward more longer term solutions of moving more housing out of the for-profit market and creating more permanently affordable housing.
Great. Thanks. Francis, did you want to have the last word here?
Well, I will say that we need to have a law that will protect us right now during this pandemic and after the pandemic, because what everything had happened is nobody's fault. Nobody asked for a pandemic. So we should have any source of getting back from the state and the government.
Great, thank you. So I'm gonna turn it over to Dean Delva, who's gonna close us out. I wanna thank all of the panelists again for your presentations and for your remarks and for this really thoughtful conversation. I also wanna thank everyone in attendance and apologize to those folks who posed questions that we may not have been able to get to, but hope that you have the possibility of connecting with some of the information that the panelists have shared about themselves and their work. So thank you all again, panelists. It was a real honor to be able to share this time with you with folks doing this really important work in this really critical time, and appreciate all that you're doing on behalf of folks here in the Commonwealth. So I'm going to turn it back over to Dean Delva, who will close us out.
Thank you. Thank you for participating in tonight's event, everyone who took the time to join us for this important discussion. Thank you to all the panelists. What an insightful set of presentations, and thank you for the critically important work you're doing in helping some of our most vulnerable populations. I really appreciated all the questions, and particularly the systems-wide questions. That's where we're here in social work. That's what the presentations, I think, highlighted, the need to provide the assistance at the individual level, as well as trying to change society to improve in all the areas that were discussed earlier. Thank you. I know, panelists, you're busy. I appreciate your sharing your valuable time and wisdom with us tonight. I'd like to encourage audience members who may not be involved in these important issues to become involved. We can use everybody's help. We need everyone to fight homelessness, to fight poverty, to fight racism, to fight oppression, to create a better world for everyone. I also would like to thank Nalaja McCoy for her leadership in organizing tonight's event, to Michelle Walsh and her team in marketing and communication, and to all my colleagues in the Center for Innovation in Social Work and Health. Tom, thank you for such a nice job leading the conversation tonight. We hope that this information from this panel can help you take some action in your own work to advance health equity during these challenging times. Thank you, everyone. Good night. Please be safe and stay healthy.